Child homicide is basically defined as the murder of a minor. So whenever it takes place, there is a suspicion of the foul play. So that has to be basically looked for by any investigator who is carrying out the investigations in a particular case, even working as a forensic pathologist or a forensic toxicologist. Both of them have to work hand in hand whenever such a suspicion of foul play is observed in a particular case. Now, the autopsy on a suspicious death, if it is carried out, we are restricting our basically discussion to the murder of the minor. That comes under the age of 16 years. So we have to basically stick to that, and we have to look for the foul plays. It can be an infant, it can be a neonate, as well as it can be still a little older child or in an adolescence. So all of these signs are quite different, and they're quite confusing in a lot of states. But still, we have to go it is basically a very comprehensive review how to get on to the investigations in such a particular case. Over here, we'll be discussing the autopsy appearances. Now, the autopsy, if it is carried out on a neonate, is quite different from autopsy which is carried out on an infant that is under 1 year of age. As well as if it is an intrauterine death, it's a completely different investigation. But still, we'll have to wrap up this investigation over here. What are the typical signs of autopsy in such a case of homicide? What one should look for working as a forensic investigator? What are the signs and symptoms? The crime scene is again very important over here, and that has to be basically completely looked for any signs or evidence that can be collected at the crime scene. Now, external examination of the cord and placenta. Now, here we are talking about the neonatal period, or we are talking about the infancy period. This is basically relating to the examination of the cord as well as the placenta, because the death occurred right after birth. So that is basically the signs that we have to look for right now. Now, the examination of the abnormalities, the fetus or the infant or the neonate has to be looked for any signs of abnormality that can basically point out towards the natural death causes that can be basically determined over here, and that can be written in the autopsy report that the child was suffering from a certain or a particular abnormality. So that has to be looked for in this investigation. So over here, the autopsy on suspicious death of a newborn infant. We're talking about a newborn infant right now. Maybe it's basically it's a viable infant, of course, that is after 24 weeks of gestation, there is a live birth, and there is suspicion of foul play because the infant die or the neonate die during that period. So the examination of coverings and the other associated articles. So it is basically we are looking for trace evidence over here when we are looking at the clothing of the infant, and when we are looking for the associated articles over there, we are looking for any signs of trace evidence that can be looked for and collected at the crime scene. So the mainly police business. So basically, working as a forensic pathologist, you should not pass on your own comments while working on the investigation. It's the police business, and let them do it. Basically, you'll write down the autopsy report, you'll carry out the autopsy, you'll carry out the investigation at the crime scene. Whatever trace evidence has been looked for, you'll just collect it. You can have a photographic memory of the crime scene, whatever you can basically provide as evidence in the court, but still you're not going to pass comments on the whole suspicion or on the whole scenario of the death of the infant. It's basically a completely police business, and that has to be kept in mind. Now, unwrapping the baby in the decomposed state, it's first of all you look for the clothing. And if something is found, for example, the blood stains or any trace evidence that can be found, that has to be completely documented. Then recovering any foreign material, it helps in the identification of the mother, and visiting the child still in situ. So once wherever the child is placed, you will visit the crime scene and you will completely get the information of the crime scene, and you'll get a report done after visiting the crime scene. Now, the infant being in the lavatory pan, so it's again very important. The head injuries or drowning, if there are signs of drowning, that has to be looked for, and that has to be documented in the autopsy report. Now, the external examination is quite important over here. The assessment of the degree of putrefaction is again very important. We have to basically state the age of viability as well as the stage of decomposition that the child or the infant is at this level. The determination of the live births is impossible if the body is decomposed, because the maceration process is still being carried out and the decomposition states are being carried out. So it's quite difficult for the pathologist to work on the determination of the live birth over here. Decomposition has to be distinguished from the intrauterine maceration because it has similar signs of maceration and has similar signs just which are present in the intrauterine death. So they have to be distinguished whether it is the stage of decomposition or whether it was an intrauterine death. So the intrauterine maceration is definitive proof of stillbirth. So if one can establish that it is an intrauterine maceration, that is going to basically point out or highlight that the birth was a stillbirth. Death within 2 to 3 days before expulsion from the uterus. The appearances are fairly normal in such a case. There is a general softening observed. Histological evidence of cellular autolysis is again present over there. It's basically the decomposition processes that can start after that. Dead for many days. It's basically a macerated fetus. There is a brownish or pinkish coloration that is given to the skin. And then we can have the rather greenish hue of putrefaction that is observed on the skin. So basically the gases are being formed, and that is going to give a greenish hue to the skin, as well as the bloatment factor is going to be there. The surface is slimy, blistered and desquamating and jelly-like in such infants. The joints are grossly loose. So it's basically the joints will be quite loose in such a case when the infant has been dead for many days. The cranial plates are virtually detached beneath the scalp. Now, macerated fetus has its own signs. It's normally sterile, may become infected when it is not expelled after the membranous ruptures. And it is born in a putrefied state because the maceration has already started during the intrauterine life. The external examination of the cord and placenta is carried out, and in such a case, estimation of maturity and any abnormalities, for example, the placental infarcts, if they are present, they are highlighted over here. The cord is basically the indicator of separate existence. If the cord is present and it is detached, it basically establishes the presence of the separate existence, that that the fetus was basically expelled from the mother. And early putrefaction, that basically gives you an evaluation of breathing that is basically impossible for such a child of stillbirth. Now, the vital signs in the cord, they indicate the live births. If a survival has reached for 24 hours, that is basically the neonatal period, till 48 hours, that is 2 days after the delivery has taken place. Now, if one has to establish the viability of the infant, he or she must examine the cord and the placenta in detail. The estimation of the maturity, and one has to look for any abnormalities in the cord and the placenta as well. The weighing of the placenta is done, and the placenta is carefully examined for any infarcts if they are present over there. Now, the cord is also an indicator of separate existence, and the early putrefaction is basically the decomposition has started over here, and it's basically the evaluation of the breathing that is impossible if stillbirth has to be established. The vital signs have to be looked for in the cord, and that basically indicates the live birth in such a case. The reddish ring around the cord base and the adjacent skin, that is again going to give pointers towards a live birth. It is marked in succeeding days, and the cord basically dries and shrivels after some days have passed on. The detachment basically occurs between 5 to 9 days after birth. Ligature indicates the involvement of a professional that basically conducted the delivery. For example, a doctor or a trained nursing staff can also conduct such a delivery. The severed end of a cord examination that indicates whether the cord was broken or not during the delivery. It is important if death is due to some sort of head injuries that occur during the parturition, and examination in hand may be floated out in the water as well. Measurement of cord length is another indicator that has to be looked for over here. If the placental segment is available, the calculation of the distance from the vulva to the floor that is carried out, the average cord length is almost 50 centimeters over here. So the cord examination, the broken cord basically shows the clean transverse termination, but it is usually a ragged appearance on the cord. If it is cut sharp by an instrument, for example, the knife, the cut may be clean and may be ragged if the instrument is blunt in such a case. Noting the cord wrapping around the neck, that is basically causing the asphyxiation of the neonate, and the skin may have vernix caseosa, that is basically a decomposition factor that we are talking about, and the intrauterine death indicator may indicate the child was washed. And the vital for estimating maturity, that is the weight, is one of the indicators, and then we look for the crown heel and the crown rump, and the head circumference is also taken at this level, and the foot length. So these are the important measurements after a viable birth or after a live birth. All of these indicators or all of these vitals that are taken, including the weight and the length of the infant, they are calculated, and they are sometimes calculated for the stillbirths as well. Now, looking for examination of abnormalities, they're quite obvious in a lot of cases. The actual live birth couldn't take place at this level, and the examples are anencephaly, severe spina bifida, and abdominal ectropion. So these are the major abnormalities that can occur in an infant that can basically lead to the cause of death in an infant. So in such a case, it will be quite sure that the infant died due to a certain abnormality that he or she was suffering from. So in this section, basically, we dealt with how autopsy is carried out in case of any suspicious death of a minor, and how can we basically signify the different crucial points over here. So that is the end to this section. Thank you for watching sqadia.com.